Duration of the disease. Quote, a gonorrhea begins and God alone knows when it will end quote, said Record more than a generation since. And the aphorism is as true today as the day it was uttered. Where there are no glands, e.g. in the conjunctiva, gonorrhea runs an acute course and then disappears. But in the genital passages, it shows a marked tendency to become chronic by causing chronic glandular catarrh and periglandular sclerosis. From the male urethra, the gonococci usually disappear within 6 months. Persistence of gonococci for more than 18 months in the male urethra is exceptional. The catarrh may continue longer than this, but it is kept alight by the associated microorganisms that persist after the gonococcus has disappeared. The exceptional case whose gonococci remain alive and at least potentially virulent for 2 or 3 years, I have known but one case to persist any longer, proves the possibility of an indefinite infectiousness. Indeed, the infectiousness of gonorrhea in the male is comparable to that of typhoid fever. Most cases last an indefinite number of weeks and are cured. A small number continue infectious. It may be a matter of great delicacy to determine the persistent infectiousness of a given case, but this does not alter the fact that almost all are cured within a few months. But gonorrhea in the female is a very different matter. Conservative gynecologists are entirely unwilling to set any limit to its infectiousness and are confessedly incompetent in some instances to cure it, in others to say whether it is cured or not. I have known a woman to infect her partner 7 years after her own infection. To be sure, most women, like most men, recover from gonorrhea in a few months. But the exceptions in women are much more indefinite in duration, much more difficult of diagnosis, much more rebellious to treatment. The vulvovaginitis of young children is exceedingly intractable. It commonly lasts for years.